Fast Tracks Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Tracks Cargo today.
Welcome to this week's edition of Health Corner. My name is Dr. Parker. The skin is the largest organ in the body, and being the largest organ, there are so many different conditions that affect our skin. Today we have the pleasure to invite a consultant dermatologist who is a specialist in skin diseases to talk to us about some skin lesions. So you're welcome to Health Corner, Dr. Jack Mann.
Thank you for having me.
Yes. Dr. Mann, the audience will be wondering, skin lesions. I know there are so many different types, but I will give you the floor to talk to us about some of the skin lesions you want us to know about today.
Sure. So, skin lesions are really any mark or bump on the skin. But when we talk about skin lesions in dermatology, what we tend to be referring to are individual lesions that aren't part of a rash, for instance. So our next question always is whether it's a benign lesion, so it's harmless and not cancerous, or if it's cancerous, which we also call malignant. As a general rule, if you have a lesion on your skin that you're worried about, please do see your GP about it or your dermatologist, and they can assess in detail. What I'm about to do now, obviously, is try and give some information about the sorts of skin lesions you may have, but of course it may take a professional to assess it to determine the best course of action. So starting with some benign skin lesions, seborrheic keratoses are very common. They tend to be associated with growing older every year rather than the sun, and they can look a bit crusty or waxy. They often look a bit stuck onto the skin. So it's as though someone had put blue tack onto your skin, but it's not blue tack, it looks brown or sometimes flesh coloured rather than blue, for instance. And they can be quite large, they can change in size and shape, so they can cause concern. And if they get injured or irritated or scratched, as they can sometimes be itchy, then they can get inflamed and become painful, maybe bleed, and they can cause concern. So we do often get referred patients with what are seborrheic keratoses, and usually we can assess these clinically and reassure our patients, but sometimes they can look unusual enough that we do end up biopsying them before we, and biopsying is when we take a piece of skin out and send it to the laboratory, and then our colleagues in the laboratory will analyze the specimens and tell us whether or not everything is all right or not.
Right, so seborrheic keratosis, is it one of the harmless ones then?
Oh yes, harmless, benign, completely harmless.
Oh, right, okay.
Now, papulosa nigra are kind of similar to seborrheic keratoses. They tend to occur on the head and neck typically. Usually they can start from someone's 20s, and they typically occur in darker skinned individuals, whereas seborrheic keratosis can occur in anybody. And also harmless, and not expected to cause problems. Skin tags are also very common. They tend to arise at areas where the skin is rubbed, so perhaps where the collar of a shirt is rubbing, or in more overweight people where the skin is rubbing together. So they are more common in people who are overweight. They're basically an area of skin that is loose and hanging off the rest of the body, if you like, quite small normally. Sometimes moles and seborrheic keratoses can look like skin tags, or essentially be like them. And once again, nothing to worry about, but they can also get traumatized or injured and inflamed, and maybe then bleed or itch, and therefore can cause concern. But usually it's quite simple to assess them clinically and reassure patients that they're nothing to worry about. Hemangiomas are overgrowths of the blood vessels in the skin. They can look red or purple, or sometimes they can look very dark, maybe even almost black. They aren't anything to worry about either, and usually it's quite easy to see them and decide that there's nothing to worry about as a dermatologist or a doc or a GP. But sometimes, because they have lots of blood flowing through them, if they get injured, they can bleed a lot, and therefore cause concern. And sometimes, if they're very scabby and very dark, it's sometimes difficult to be 100% sure. Once again, as before, if any concerns about any skin lesions on the body, do see your GP or dermatologist.
Right. So the blood vessel and hemangioma is responsible for the color.
Yeah. So there's lots of relatively more blood flowing through those areas.
Okay.
Dermatofibromas are very common. They're usually firm papules on the skin, often on the lower legs. If you squeeze the skin around a dermatofibroma, the skin often indents over the dermatofibroma.
Right.
They're commonly thought to be a result of insect bites, and the scar formation after the insect bite might be causing a dermatofibroma. But often we don't have a known cause of them, they just seem to appear.
Right.
And also harmless. You shouldn't expect a dermatofibroma to keep growing. Obviously, like all things, it will grow initially while it's appearing, but then it should stop and be the same.
Right.
So
the picture here is the two fingers squeezing.
Yes, that's right. The two fingers squeezing the skin, and the skin should sort of dimple up over the dermatofibroma.
That's interesting.
Keloid scars are another sort of malformation of the scarring process, if you like. Much more common in darker skin types, and also common on areas like the chest and the back, but also the earlobe is a common place. And these are scars which are lumpier and bigger than the area that was damaged, for instance. So if you have an ear piercing and you get a keloid scar, the keloid scar will be likely bigger than the ear piercing hole, if you like, as you can see on that image there. And these can be very difficult to treat. One's instinctive thought might be to cut it out, but of course then you're causing more damage, there'll be more scarring, and you will just get another keloid scar much of the time. We can use steroids or inject steroids into them to soften them up, and that may work really well. It may go too far and make a sort of dent in the skin, but often it's very difficult to get a good result with these. People use all kinds of things, from lasers to cutting out and injecting steroids to radiotherapy, and there's always a risk that they'll just come back afterwards and be more troublesome.
So can any doctor just treat this, or does it have to be a specialist?
I mean, a lot of dermatologists do a lot of treatment for this. Plastic surgeons do. There may be general practitioners also who are comfortable and have experience in treating these. But yes, as before, it's sometimes very difficult to get a good result.
Excellent.
Cysts are collections of fluid or fluid-like substances under the skin, usually in a sort of capsule-like formation. They tend to, they can be quite large, or they can be large enough so that you can see them through this, or you can see the sort of impression they make on the skin from underneath. So there'll be a bump, and underneath they'll feel firm and sometimes hard, sometimes a bit soft, or like fluctuant, because you can sense there's fluid inside them. They are harmless, but they can get infected, and they can also sometimes burst and release some sort of material, sometimes a cheesy material, which obviously isn't the most welcome of experiences for the patient, but they're not actually dangerous. Once again, although they can vary in size, they should not keep growing in size. And I would suggest that if you have a diagnosis of a cancer already, and then you had something that you thought was a cyst, it probably is worth getting that checked out with your doctor sooner rather than later. But generally speaking, they're fine, and in many health services they may not be something that the health service might cover the treatment of, because they're not dangerous, but they can be large and troublesome, and as I said, infected, and they're quite easy to remove actually. Lipomas are overgrowths of the fat cells. So in the skin you have the top layer of skin, the epidermis, and then you have the dermis, which is a thicker layer of skin, and underneath that there is fat. And commonly you can get an overgrowth of fat cells, which is like a lipoma. They're soft under the skin. They cause a swelling in the skin, like the image shows there, and also harmless.
And So they're just a collection of fats.
Yeah, it's like technically it is a tumor. Like you have a mole is like an overgrowth of melanocytes, the cells that make pigment. You know, a lipoma is like an overgrowth, a harmless, benign overgrowth of the cells that make the fat.
Right. Maybe what some viewers might be asking how do you know the difference between lipomas and cysts?
It's not always obvious. Usually it's obvious because the lipoma is softer and the cyst is harder and more round and things, whereas the lipoma often isn't necessarily as round shaped. But usually it's the softness which would help you differentiate the two. And sometimes it is difficult, especially if they're deeper into the skin. The cyst is also usually higher up, and lipomas shouldn't produce any cheese-like material coming out of them. But yes, they're harmless. They can cause trouble if they are in an area which rubs against your chair when you're sitting down at work, that sort of thing. So they can become a problem, and some patients find that they get in the way when they're doing sport, for instance. So you know, those are common indications to have them treated or removed, as it were. But with both of them, cysts and lipomas, if they are removed, they can sometimes come back if you're unlucky. So folliculitis keloidalis or acne keloidalis is the same sort of thing. It's a problem that typically affects darker skinned young men who cut their hair short at the back of their head and neck. It would initially start as more of a rash kind of process, so papules, and I think the thinking is that it's probably ingrowing hairs that might start the whole thing off. Then these get infected and scar, and gradually it gets worse. You then get a keloid scar, and this might get a bit boggy. It is quite difficult to treat in general. It's easier to treat the sooner you start trying to treat it, because if you wait till it's a large sort of keloid scar-like process.
This is very common. And does it occur more in the back or the neck?
Oh yes.
Yeah, because some people, you see the back of their head is so lumpy. And
that's right. That's the typical place where it happens.
Right. Does it have anything to do with barbing with dirty machine or dirty barbing machine?
I mean, bathing sort of things.
No. You're going to the obviously if you go for a haircut and the machine is not clean. I don't know if there's any relation.
I'm not aware of any. I mean, generally speaking, one considers hygiene an important thing to take into account when trying to reduce the risk of it getting worse, because infection does seem to play a role. So I suppose yes, if you had your hair cut by dirty clippers and some infection got in there, that would likely make it worse. I think a lot of the thinking about this is that the hairs are short, so they tend to grow into the skin, and that's causing an ingrowing hair problem. But yes, then infections and things, as one of the measures advised to help reduce the risk of this getting worse, is to have good hygiene and consider antiseptic washes. Other treatments include antibiotics or sometimes steroid injections, and if it's really bad, cutting it out or lasering it out. But there's always a risk that then you'll just get a big keloid scar afterwards, of course. Right. Pyogenic granulomas, they're sort of raw area lumps that occur usually after an injury, but they're also nothing to worry about really, but you probably would see your GP about them anyway because they're troublesome, and if you came to see us in dermatology, we would get rid of them for you because we want to just make doubly sure they're not cancer. So not that I'd expect anyone to wait around with one of these, please don't. Viral warts, they are infections of a virus that cause a lump in the skin. Usually it's quite hard. Most people have probably had them at some stage in their lives, but usually you grow out of them. Basically, it's a question of time until your body recognizes the virus and starts killing it off. And the treatments we do to treat them essentially revolve around damaging the skin cells so that the body recognizes the virus particles and treats them. So freezing or acids or scraping them off are commonly used methods.
And they can occur in any part of the body, isn't it? Pretty
much. I mean, the feet are very common. Verrucas are a type of viral wart, and the hands. But I guess, yes, they can occur anywhere. Molluscum are a similar sort of thing. They're viruses causing a growth in the skin. Also, generally, they shouldn't last more than a year, usually, before your body realizes they're there and gets rid of them. But there are some treatments you can use, some over the counter, to try and accelerate that process.
Thank you very much. Thank you very much for giving us an excellent, this is background. I know that there's so many of them. For viewers who are joining, today we're talking about skin lesions, and we have Dr. Jack Mann, who is a consultant dermatologist in the UK, taking us through some of the common skin lesions. We're going to take a short break. don't go away. I will be back to talk more about so many of the skin lesions we see every day and which we probably don't understand. Stay tuned.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Trax Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Trax Cargo today.
Health Corner on Ben TV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Okay, welcome back to the second segment of today's Health Corner. We're talking about skin lesions. If you're joining, we have Dr. Mann, a consultant dermatologist in the UK, taking us through the common skin lesions we have. We know that many of the skin lesions are harmless, but some of them could be very harmful and dangerous. So, Dr. Mann, I know there are congenital moles, the ones we call moles from birth. Can you tell us a little bit more about this?
Sure. So, some moles a patient may have will be there from birth, and we call these congenital. Some of them actually present a little bit after birth, so very young children may get some sort of skin lesion that will stay with them from then on. They can grow as a child grows, so the fact they're growing at all isn't necessarily a sign that they're dangerous. But if they're quite large, at least say especially if they're 5 centimeters or 10 centimeters, you should really get them seen by your GP and probably a dermatologist as well, as they may need monitoring. And if they start changing in a way inside themselves that looks unusual, then they probably also need to be seen urgently. But most of the time they'll just stay there, they'll be harmless, and they may just get a bit bigger as the child grows. They can be a bit warty, they can be a bit sort of shiny, and they can also have lots of hair growing through them, but that's fine. Moles in general, so benign moles that aren't dangerous. Lots of patients have moles. They'll obviously be a bit more common in lighter skinned people than darker skinned people. But the sort of things we think about when we're trying to reassure ourselves that they are not dangerous is whether they're small. So a smaller mole is probably more likely to be okay. It doesn't make it mean it definitely is. Regularity in how the colouring is in the mole, so if it's all one sort of shade of brown, then that's a good thing. If it's a regular shape, so a nice circular shape or oval shape, that's also reassuring. And also it's important that it isn't changing. So obviously when any mole starts, and you can be getting new moles certainly up to the age of 40, then it may well change initially when it's growing into its natural state, but after that it ought to stay the same. They can of course change a bit during pregnancy or if they get injured, but generally they shouldn't really change that much after they've sort of reached their final state. And if they are changing, that's a good reason to get seen by your GP or a dermatologist. And that's certainly one of the things we pay a lot of attention to.
There's something we call the borders.
Yes.
Is this something the public should look out for as well?
Yes, so the edge, the shape of the mole, if the edges are quite, smooth, then that's a good thing. But if they're not so smooth, then that's more of a worrying thing. And I do have some pictures of some melanomas coming up that are running along the nail. And this is very common in darker skin types as well. If you have other family members with these, or if you have them on other nails of yours, your hands or your toes, then that's reassuring. It's probably just completely normal. Things to worry about would be if it's getting wider at the base, or it's changing a lot, or if it's changing at all really. As before, when it first appears, it may change a bit as it grows to its natural state, but changes after that would be worrying. And having these in paler skin types is also more unusual and therefore more of a cause for concern.
So the line we have on this nail,
yes,
this is fine.
This is fine, and you see that it's the same width throughout, And I think also if it was in the right context, so the skin was a darker skinned individual and they have other family members, and this is probably going to be fine. Yeah, you might end up monitoring this with a photograph, but you'd be less likely to do a biopsy. But sometimes we do biopsies. The danger of doing a biopsy on the nail is that you can disfigure the nail a lot with it. Another common thing with nails is having blood under the nails, which can look dark and can be very worrying. Usually there's a history of trauma. You've injured the nail before. Sometimes there isn't. But then another reassuring thing is that usually they become dark, as it were, quite suddenly, and then they stay that way rather than gradually getting worse as they would do if it was some form of malignancy. So regarding cancerous skin lesions or malignant lesions, this is when there are abnormal cells invading into the skin, or possibly trying to invade other places in your body. And if you're concerned about this, please do see your GP or your dermatologist. Now, the most famous one of these is melanoma.
Melanoma, okay. So these are pictures of melanomas.
Yes, that's right, yes.
Okay.
So these are moles that have become cancerous. So the cells that make the pigment in your skin and that are overgrown when you get a mole, if these become cancerous, then they are melanomas. And they are quite dangerous, actually. So just as most moles are fine, if you have a melanoma, it's very important you get it seen soon. And the things that make us worry are that it has an irregular colouring, so it's not all the same colour throughout. Especially if the different colours are on either side of it, as opposed to one colour in the middle and another colour on the outside. But still, any colour changing colour is also a very important thing to consider. If the mole is getting darker and it wasn't so dark before, and an irregular shape, and you were talking about borders earlier. So if the edge is not smooth and it's a strange shape, so not a round, smooth shape, that's worrying. And if it's large, so if a mole is bigger than 6 millimeters, that doesn't mean it's cancerous, but it's a sign that we would take into account when deciding whether or not it's dangerous. And changing is really important, because a cancerous mole means there are lots of cells dividing and growing, and so it's likely to change a lot. And bleeding and hurting in the context of melanoma is more of a late thing, but I guess still, it's worth mentioning if you have a bleeding, hurting mole. It may be you've just injured it, but it would still be worth taking into account when we're assessing a mole. Now, in darker skin types, it's much less likely to get skin cancer in general, because the darkness of the skin, the melanin in the skin, protects the skin cells from becoming, damaged by the sun. So in dark-skinned individuals, where one is more likely to get a melanoma, because it can happen anyway, but if it is going to happen, it's also more likely in the nails or on the soles of the palms, or the soles of the feet or the palms of the hands. So there's a picture there on the left of a melanoma, an early melanoma on the nail. And you might be able to see that it's sort of darker in the middle and at the bottom, and so it's not all the same the whole way through. So that's a changing line down the nail there. And so the patient would have reported that this nail was changing like this and getting darker at the base there, and that was a melanoma. But you can get ones that are a lot worse than that. If they get really bad, the skin at the base of the nail can go dark as well, and usually they are wider at the base. So where the cuticle is, if that area is wider than the end of the nail, that suggests the mole is growing very rapidly and would be more indicative that it could be a melanoma. As for melanomas on the palms and soles, they can obviously look like other melanomas, but just, dark lesions, any sort of ulcerated lesion. As I said before, pyogenic granulomas are a common benign condition you can get, which bleed a lot and appear on the soles a lot. But we would always biopsy those just to make sure they're not melanomas. So do be aware of any strange lesions appearing on your palms and soles. Basal cell carcinomas are very common, but more so in paler skin types than darker skin types. And they're slow growing, they hardly ever spread, so they're not something that we rush to treat, but they are cancer, they will get bigger, they will cause problems, so we do need to treat them, and the sooner you treat them, the better. They tend to look a bit sort of translucent and pearly coloured, and you can sometimes see these blood vessels in them, and they grow very slowly over months and years.
Do they bleed as well?
They can do, yes. That's often what brings patients to our attention. When they start bleeding, they then start worrying about them. Squamous cell carcinomas are more dangerous than basal cell carcinomas, but not as bad as melanomas generally, but they can grow very quickly. They're also quite common, and like with basal cell carcinomas, associated with sun damage. And also, if you have a weakened immune system, that can increase your risk of getting any skin cancer.
Yes.
But it seems, in particular, squamous cell carcinoma.
Right.
So anything that's growing very quickly and bleeding and hurting, squamous cell carcinomas often do that.
Right.
Then it's very advisable to get some medical advice quickly,
Right.
as these will need to be removed soon. There are lots of other rare skin cancers. Yeah, so dermatofibrosarcoma protuberans or Merkel cell carcinoma, and then there are adnexal tumors and sarcomas. These are things that anybody can get, but generally associated with later age groups. Although some of these can occur at younger individuals too. It's difficult to explain or even describe all of them or be able to predict them. If you have a lesion that you're concerned about, just see your doctor, see your GP or your dermatologist, and they can always assess and do a biopsy if needed.
Right.
So I think a sort of simplified approach to this, I mean, no approach is ever perfect, but if you have any strange moles that are changing or getting darker or worrying you, then definitely see your general practitioner or dermatologist. And any bleeding or hurting or rapidly growing lesions or any growing lumps that you're not sure about, please see your GP or dermatologist for an assessment.
Thank you very much for that. Okay. So, closing remarks, Dr. Jack Mann has told us, if a mole is changing, you can have a mole all your life, but when you start seeing changing features like growing hairs, getting bigger, getting darker, getting irregular in shape, that might be a warning sign. Please try and see your doctor. Dr. Mann, we thank you for attending to our invitation today, and I'm sure there are more to talk about our skin.
Okay.
All right, viewers, if you have any question, look on the screen, send us text or check our website or send us email. I'm sure Dr. Mann will be happy to answer your questions. And if you want to partner with Health Corner, you're always invited to join with us and keep bringing this show to you. Dr. Mann, I hope if we invite you next time, you won't mind to come and share your knowledge.
Pleasure.
Thank you very much.